Fellow nursing colleagues, it gives me great pleasure to speak to you, to address you as we observe International Nurses Week 2022 under the theme, A Voice to Lead, Invest in Nursing and Respect the Rights of Nursing to Secure Global Health. This year's theme is geared towards the need to protect and support in the nursing profession by shifting health systems around the world. As you can see over the years, ICN used several themes. However, this year is special. This year is used as an effort to recognize the many nurses who contributed and continue to contribute to the shifting health system locally, regionally, and internationally. Nurses, who are we? Nurses were once known as physician assistants, physician helpers, but as the profession evolved, nursing now requires years of study and extreme focus and dedication, making us the respectful professional as we are today. We are respectful, skilled, critical thinkers, guided by critical judgment. We create differences in lives. We are the foundation of healthcare. Our foundation is grounded in research, informatics, healthcare management, education, service, management, whether it's in the public or the private sphere. As the theme states, we are the voice to lead. Hence, from nursing school to administering medication in a family island, in a remote family island, we are highly specialized. We assist in saving lives. We make treatment decisions. Clearly, we demonstrate our ability to lead in the medical field. Yes, we have earned the respect we deserve, especially over the last 2 years. Never before have we seen an outbreak as we had seen during the COVID-19 pandemic. As healthcare professionals, we took on the task taking care of patients when we did not have enough supplies, equipment, staff, or resources. But yet we run towards adversity to take care of those patients because that is what we do. The pandemic has done one thing. It has brought out to the forefront that nurses were overlooked and underestimated. To secure global health, there must be a real investment, a sustainable investment in our profession. We must agree that we must first have strategies in place to protect and support our nurses. We need tangible investments to keep nurses safe, secure, and well. The reality, however, is that the nursing profession is in a crisis. While the potential dangers of the virus have enforced physical distancing and virtual events, and nurses continue to work through those challenging circumstances, we continue to go above and beyond to deliver highly skilled, competent care to patients every single day. And every single day, nurses embrace the mantra of vision to lead. And many consider whether to continue working in the healthcare. The need to invest is clear. Investment in nursing needs to be strategized across all aspects of the profession. So again, if you are a nurse that's in a clinic, in a hospital, in a private home, on the Defense Force base, wherever you are, we must heed the call from all corners to listen, to support, and to protect our profession. Which brings me to my vision. I propose several solutions in about 4 areas to help us as nurse leaders to take steps to adjust the norms and expectations that contribute to protecting, supporting, and investing in our nurses. This theme is a voice to lead, secure global health. Regardless of where we are, we need to do it together. But before we look at the four areas, let's first look at global health. Global health is the health of the populations in the worldwide context. It has been defined as the area of study, research, and practice that places a priority on improving health and achieving quality in health for all people worldwide. Global health security, however, depends on many factors, one factor being investing in nursing. Nurses are the foundation in the healthcare system. Other components of global health includes national lab networks, establishing infection prevention and control policies, strong community investment, visionary leadership, and early warning systems. Above all, global health depends on one health approach. It depends on a one health approach model that integrates the work of human health, which is nursing, and the work environment. All of this depends on the availability of nurses at all levels of the health system, especially at the health level. The goal is to be able to respond to the known and the unknown health threats. So here's why we need to invest in nurses. Nurses need to be available and prepared to respond to these health threats, these health emergencies. Health security is built upon trained and well-supported human health workers. Those human health workers are our nurses. Nurses need to be well. Well nurses equal a well society. A well society equals good global health. So what exactly do we have to do to protect and support and invest? How do we align ourselves with this theme? Invest in nursing and respect rights in the Bahamas. How do we restore our vision of nursing? But before we can look at restoring our vision, we need to first acknowledge that there is a nursing shortage and there is an underinvestment in nursing. We need to acknowledge that we need to expand nursing opportunities. We need to increase our student pipeline. The system needs more care. The system needs an injection, and that injection is an investment. Yes, we have policies. Yes, we have initiatives, but we need to address some of the obvious: nursing jobs, protection, environment, safety. Nurse leaders have always been challenged, even before COVID-19, to provide resources while creating safe, effective workspaces. The pandemic somehow rearranged those priorities and challenged the safe environment. Around the world, not only in the Bahamas, nurses describe the absence of resources, infrastructure, and we continue to have those discussions of lack of PPEs, poor staffing, support for the mental health, infection control practices, and more. Those are just obvious areas that we need to invest in. So those were the obvious. Even before COVID-19, those were areas of discussion. But I want to talk about four low-hanging fruits here, four investment areas that I think we can use as short-term goals to secure global health in the Bahamas. Leadership being one, technology, education, better healthcare delivery service. Investment number one, leadership. Leadership is visionary. I believe that nurses, in order to positively impact global health, we need to work with other countries from a global perspective in 4 areas. And those 4 areas would be in education, what are others doing? Practice, what are other countries doing? What are best practices? Research, we need to put research to the forefront, use evidence-based to guide our practice, and healthcare policies. We as a group of leaders in our country today, we can start right now by developing a task force to address these issues. We need to empower our nurses, our young nurses, the ones that are coming up. And I want to share a story on one of my opportunities as I explored the globe and my experience that now in retrospect, I can see what that country was doing to expand their global health. Yeah, so here I am in the middle of one country's initiative to support their global health. While there, I learned that China has developed modern medical equipment. They have created new pharmaceuticals and medical products. China undoubtedly has the fastest growing healthcare system in the world, and what they did is they brought in professors from around the world in nursing to bring real time experience and simulation to their classroom, to their nursing schools. We can take on this model to better prepare our nurses for higher roles. We can take on something very similar to expose them to this type of mentorship so that they too can be better prepared workers to respond to healthcare emergencies from the global perspective. Investment number 2 is technology. Technology is needed to secure global health, whether it's through mobile devices, diagnostic devices, robotics, data analytics. These technology are transforming the healthcare landscape for nurses. One of the most neglect is technology in nursing. It has diffused into the majority of the majority of fields except nursing. But yet, the majority of work that we do is physical. It's physical work that can be automated. At least 80% of it can be automated. Our healthcare system in the Bahamas is begging for a new process, is begging for new models and systems and products that can achieve better managed populations as we strive to support global health and improve patients' experience. We can invest in harnessing on emerging technologies. These technologies will meet these imperatives that will occur, and these investments will be made to the largest group of clinicians, which are our nurses. Investment number 3, nursing education. Clearly, we did not have enough healthcare workers to be able to address the challenges we faced here with the pandemic. So why invest? Why do we need to invest in nursing students and nursing education? We need to invest so we can train and retrain enough nurses to respond to current and future health needs. We need investments in quality training and ensuring adequate pay and decent working conditions, which too will improve health outcomes. We need state-of-the-art simulation labs. We need to procure state-of-the-art simulation labs for our nursing students. We need to review our hours. Our current Nursing Act requires 1,500 hours compared to 900 for United States and 1,000 for United Kingdom. We need to diversify our programs within the university to include disaster management and nursing informatics. We need to relook at our current nursing model where we are looking at post-basic programs and certificate programs for persons who hold bachelor's degrees. I think we should invest in master's degree programs for those groups of students. We need to develop our mentorship programs for our nursing students because one day they too will be nurses, and every nurse has a story, and every story has the potential to improve the health system and enable individuals and communities to achieve the highest attainable standard of health. So when we ask why invest in nursing education, remember maintaining a robust nursing workforce is important to meeting the needs of patient population and global health. So nursing education can help correct the shortage of nurses in our country if we invest in a sustainable way. So we've looked at investing in leadership, we've looked at investing in technology and nursing education. So finally, we're going to look at investing in better healthcare delivery systems. So what I want to do is draw your attention to Miami-Dade County. As you know, Miami is 50 miles north of Bimini. And so many of us have visited there, but we've probably never taken note of this. The sales tax is 1% higher in Miami-Dade as compared to any other of the counties in Florida. And primarily because 1% from 1985, they voted on a sales tax in which 1% goes to healthcare. And that's chunked out in different areas. But why am I bringing this to your attention today? I want to admonish all of us on this, who's listening today. Let's advocate for something here for nurses in the Bahamas. I know we are always complaining about this 10% VAT and whether it's 12% and all this different stuff. But what if in the perfect world healthcare got half of a cent, just half of a cent? I'm just gonna tell you what that 1% has done in a particular county in Florida. In 2018, they raised $36 million for that county. $36 million. 10 million covered what they call Medicaid bills for very low income children, for elderly, disabled residents. Then there was another 2.5 million for alcohol and drug abuse and mental health services. And the list goes on and on about how this monies were spent. Ever so often, persons would come to me and say, they need to pay those nurses better in the Bahamas. And I say to them, but who's paying for health care? When we compare ourselves to the great United States, persons are mandated to have insurance. They pay for their health care services, the majority of them. So in this non-perfect world in which we live in, and as we think about ways to investing in nursing, what if we got that half cent? Can you imagine nurses? You would get better pay. We would have more equipment, more resources, supplies, and our patient outcomes would be better. We've done good in medical in terms of exempting medical equipment. That's very, very good. We have invested in that. So that's long been exempt from customs duty. But I just want to leave you with the thought about how we can generate millions, if not billions of dollars in revenue each year that can be earmarked for healthcare in the Bahamas. So in conclusion, we are a voice to lead, a voice to lead to do better, a voice to lead to get what we need done. We are a voice so somebody would listen to us. We are a voice that we can speak for ourselves. Let us invest in ourselves by earning the respect. Let us mobilize, if not all of the 4 strategies that I listed today, at least one to secure global health. Remember, colleagues, we cannot save ourselves if we are not willing to participate in the rescue. Thank you so much for listening and have a great Nurses Day.